Hi, my name is Lindsay Winkenbaugh. I'm a pre-med biochem biophysics major, and I took HHS 231 in the winter. While I was in high school, I was so busy I never felt like I had the time to eat well or work out, and I also didn't know how. Growing up, nobody in my house made exceptionally healthy choices, so I didn't have anyone to turn to for guidance. When I came to college, I knew that I wanted to change my habits, and HHS 231 gave me the resources I needed to change what I want to see in myself.
Hi, my name is Brady McBride and I took HHS 231 in the fall of 2012 as an incoming freshman. My most significant behavior change I've learned throughout the course concerns my daily intake of fresh fruits and vegetables. Before HHS 231, I was well aware of the importance of produce in an adult's diet, but I was oblivious to the limited amounts of fruits and vegetables that made up my own diet. I used to consume vegetables very scarcely, perhaps once or twice a week, with dinner while I was living with my parents and later in the dorms.
Hi, I'm Amy Eisenstein and I am a junior majoring in public health, health promotion, health behavior. I have overcome many issues in my life, one of them being cigarette smoking. However, before taking HHS 231, I still had not gotten over my body image and food issues. I felt as though I would always measure myself against impossible standards. And before HHS 231, I had been trying every diet I could get my hands on. And not only did I not lose much weight, I felt bad about myself to the point that it was interfering with my relationship with my fiance. I attempted to eat well and I've always worked out, but I feel I was doing it for the wrong reasons.
HHS 231 helped me learn about and change 3 important areas: eating healthier, exercising more, and managing my stress. The healthy eating aspect of this course wasn't too difficult for me to get my head around and start changing my habits for the better. The hardest part was choosing how to be active, but I learned that focusing on one behavior at a time is the best approach to making lifestyle changes. I started with getting a Fit Pass and trying out the body pump class, Zumba, and free bootcamp class at McAlexander Fieldhouse. Each of these classes were so much fun and really helped me get into a fitness routine. Since then, I've continued taking those classes and started exercising more on my own. I learned that all exercise, no matter how little, is very beneficial. Regarding stress, the exposure to so many different stress-reducing techniques immediately took a load off my shoulders. Just knowing I had all those resources to consider was calming. And the actual techniques were helpful too.
The most significant thing I took away from HHS 231 was the ability to observe, record, and alter my own eating habits. I was aware that I wasn't eating as much produce as I should be, but it was only after completing a behavioral change analysis, where I logged everything I ate for a few days, that I realized just how little fruits and vegetables that I was eating, and that I needed a dietary change. The hardest part of changing this behavior for me was finding and understanding a motivation for change. Personally, just knowing the nutritional benefits of eating a well-balanced diet was not significant enough to inspire a change, but saving money was. I found that if I spend a decent amount of money on fruits and vegetables once a week, I'll be more inclined to eat them and not let that money go to waste.
During HHS 231, I heard several stories from TAs about exercise and body image that got me thinking about health from a different perspective. They also taught me about non-weight related benefits of exercise and healthy eating. Over the term, my goal of being thin paled in comparison to all of the benefits I would gain from living in a healthy way.
Since taking this class freshman year, I now work out 5 to 6 days a week and eat as healthy as my cravings will allow. Because I am a science major, I love to think about the science behind metabolic energy and the different energy systems being engaged while I'm working out. My stress levels are under control, and overall, I feel stronger as a person.
I'm currently living on my own, and because of this, I'm in full control of my diet and the amount of fruits and vegetables that I eat, which has greatly increased since taking HHS 231. I now understand the steps for a behavior change and know the next steps to maintain my new behavior. And I honestly do feel much better now that I'm eating healthier.
My motivation for being fit has shifted from external and superficial toward internal, and I am really grateful for that. I still struggle with body image, but I feel like I'm moving in the right direction now. I'm so grateful to all the instructor and the fabulous TAs of HHS 231 for helping me to shift my perspective on fitness and health.